it's 3, 4. That's 4 of us now.
Countdown.
Need
So
one more.
yeah, you need one more. But in the meantime, people who are not board members or staff members, if you wouldn't mind signing in the chat, and if you have any agency affiliation, put that in there too. That helps us so much when we're trying to create a record of the meeting, even though the recording is a record. The chat is a really good record as well. So thank you for doing it.
And Jane is about to check in.
And here comes, oh,
Thought Jane was about to check in.
and here comes Dr. Joachim.
Okay, good.
And Molly McClay was in the queue, but then disappeared. So I don't know.
I'm here.
You made it. I must have clicked on admit somehow. Yay.
And Jane's here, so I think we got it. We're ready to roll.
Okay. So, and I'm in the Shields Carter room to make sure that we're compliant with the revised Open Meetings Act expectations under the continuing executive order. Mr. Bryson is also here to make sure that we are able to greet the public if anyone were to come in, and Alexa McCoy is joining the meeting too. I'm going to put the agenda for this meeting into the chat for folks, and I think Dr. Joachim is rejoining. Okay. So hopefully he will be able to. There you are. Dr. Joachim, can you hear us now? Okay, can you hear, wait a minute, can you hear me through the Zoom now? No, okay.
I can't hear anything.
Do you want to try
I don't
coming?
know why. I tried signing out and signing back in.
Okay.
You're on mute.
Sorry. Well, I've got you on this. Maybe maybe this will work. If that.
I mean, it's not
Sorry,
ideal.
it is working. I can hear Dr. Joachim through your audio, Lynn.
I can unmute myself. I'm sure you guys can hear me on here, but
I'm not sure why
Oh.
I can't hear the audio. It's so weird.
Okay, so you can't hear us. That's the problem.
Yeah, I can't hear anyone.
So we had a cat-related incident with one of our computers a few weeks ago where a cat had turned the audio off on a computer. I don't know if you have
This sounds like a bad joke.
roommates like that, but
I mean, I never use the computer for anything other than like this kind of stuff. So weird.
well, we will keep you. I mean, okay, so that you can hear the meeting, I'll keep my phone on, at least for now.
All right, that sounds good.
Okay.
Yeah.
Okay.
Oh, technology. Okay, so we could, I think we've got a quorum. So
Yes,
ready,
please.
ready to start when you are.
All right. So I guess we'll call it
Matt Hausman,
Here.
Daphne Maurer,
Here.
Alexa McCoy,
Here.
Molly McClay,
Here.
Joe Omosagie,
Here,
Elaine Palencia,
Here.
Kyle Patterson, Jane Sprandel. Jane,
I don't think we heard you, Jane.
we can't hear you. You're here though, okay. John Paul Joachim.
Here.
Okay. Here comes the agenda.
So, I guess we'll have approval. Do we need a motion to approve the agenda or, all right, so I'll move to, I'll move for a motion to approve the agenda items for today.
I
So
will,
moved.
okay. I will second that.
Is there any
Uh,
discussion?
No discussion for me here.
All right, seeing no discussion, can we get a roll call for the vote then, I guess?
Daphne Maurer,
Yes.
Alexa McCoy,
Yes.
Molly McClay,
Yes.
Joe Omosagie,
Yes,
Elaine Palencia,
Yes,
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
John Paul Joachim.
Yes. All right, next on the agenda is citizen input. Is there anyone in the audience that would like to make any comments? All right.
I guess, could I make a comment, please?
Yep, yep.
Okay. My name is J.R. Lill. I'm the iPlan coordinator for Champaign and Vermilion County. I'm currently running work groups in Champaign County, behavioral health, which is focusing on mental health and substance abuse. Healthy Champaign counties is active living and food environments and their impacts on obesity. And then the violence prevention group, which is Community Coalition and the Blueprint. So if you have any questions about those, I'll relink my information in chat. Also, you can contact Lynn and Lynn will get you to me too. So thank you.
thank you.
Are there any other comments tonight? Seeing none, I guess we'll go on to the next thing, which is just my comments. I know we have a lot to cover tonight, so basically I'll just keep it short. This year school is going to be a little different. There's a lot of kids going back, and there's a lot of people not wearing masks. So this will be kind of a year or a winter that kind of tests a lot of people's health, and then that might put a lot of strain on families and their resources. And one thing that I do see a lot of in the last year, obviously before the pandemic, we saw a lot of was an increase in mental health concerns for teenagers. But during the pandemic, obviously we've seen a big rise, and this year is no different, even with things getting more back to normal. So obviously all the services that local agencies are providing are very valuable, and I do appreciate everything that all these agencies and everyone that's working so hard in the community is providing. So thank you to all that provide services that help everyone in the community. Thank you. And I'll go on to Lynn's comments.
I agree that I should keep it brief because this is the big board packet, and then we're meeting again next week with another big board packet and lots of important business. So really, I want to say that this is really probably my favorite time of the year for our work, maybe because we're living in the past, present, and future all at the same time. like looking at the year-end reports from agencies regarding the period that ended June 30th, and then hearing from Mark Aber about the project, which we've had with them for 7 years. And then also we begin preparing for program year 24, which will start July 1st of next year. And in the meantime, somewhere right in the middle here, we're going through our online system to tweak it so that it's easier to use. That's the goal. It seems like an infinite goal for agency reports, which will be coming in starting in October. So, you know, it's a lot of troubleshooting, but it's still kind of exciting. And I think that we learn from the year-end agency reports, some of the things that we need to know for planning for program year 24. So it's not difficult to be in this moment. I actually really enjoy it. So anyway, on with the show.
The next item is the approval of CCMHB minutes. I'll give a minute for everyone to just take a look at that.
If there is no discussion, I make a motion to approve the minutes as presented.
I will second. Roll call, please.
Alexa McCoy,
Yes.
Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Valencia,
yes,
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
John Paul Joachim.
Yes. So the next item on the agenda is the vendor invoice list. I think the only question I forgot to ask Lynn was whose audit was it for John Brustine, the 2021 quality audit?
All of them.
Okay.
He looks at, what he does is, we forward him the audits, and then there are some financial reviews and compilations as well. And he compares with our checklist and with our expectations and sends us back summary reviews of everything. He's a certified public accountant himself.
Okay.
So
Perfect.
it's very helpful to us. So.
Does anyone want to approve the minute or the invoice list?
I move to approve the invoice list as shown.
I will second the motion.
All right, can I have a roll call?
Joe Omosagie,
Yes.
Elaine Valencia,
Yes,
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Alexa McCoy,
Yes.
Molly McClay,
Yes.
John Paul Joachim.
Yes. All right, now we're on to new business. So we have the presentation for the UIUC Evaluation Capacity Building Project.
Thanks, John. Hello, everyone. Thank you for the opportunity to speak with you briefly this evening. My name is Mark Aber. I am Professor Emeritus at the U of I in the Psychology Department. And I've been working with my colleague, Nicole Allen, and with the board and funded programs to build evaluation capacity for the last 7 years or so. And not or so, exactly 7 years. Can everyone see that the screen I just put up?
Yes.
Okay, thank you. Let's see if I can get it to go into, there we go. So I want to just thank my collaborators this year, Emily Blevins and Hope Holland, both veterans to this project, graduate students in the psychology department, put in a heck of a lot of work. They were the ones who worked most directly with targeted partners. And Nathan Todd, my colleague, who is also a professor in the psychology department. And what I'd like to do tonight is just briefly go through the main goals of the project this past year. They are consistent with previous years, and give you a couple of details, and then save a little time if you would like to ask questions or discuss. So I'll just jump right in. This year, we continued to work to try to create a learning organization among funded agencies and the boards. And learning organizations are collections of organizations that are working to establish a shared understanding of some phenomena or some process or set of information. And here what we're really working to do is to create a culture that values and understands the importance of collecting data to try to improve programs, both the delivery of the programs and the outcomes that they produce. So the primary ways we do that is through our targeted partnerships, where we are constantly trying to point out and share with our partners the value of evaluation, showing them how evaluation can be meaningful, and encouraging them to experiment with collecting data and with interpreting it. We also encourage the partners to present some aspect of their work this past year with advisory council, with their peers on the advisory council during their July and September meetings. And those have been traditional ways that we have worked to try to create a learning organization. And I think we've made some progress over the years. I think with both the programs themselves and the organization of programs as a whole is a little more savvy about, and certainly more appreciative of, less fearful of evaluation. The second goal was to continue to support the development of theory of change logic models. These are the devices we use to help programs to think through why what they're doing should produce the outcomes they hope to achieve. We map out the activities, the short-term outcomes and the long-term outcomes, and then we develop ways to try to measure them and use those as devices for evaluation. We offered 2 workshops this year, both virtual. They were attended by 5 agencies. And after those agencies completed the workshops, they ended up with digital editable versions of the model that they can use going forward, that they can use as a device to discuss their programs and to try to get on the same page about what they're trying to accomplish. And it's they can also edit them and change them, as these theory of change logic models are sort of working tools that are constantly changing as the programs change. Our third goal was to continue to build what we call a buffet of tools, resources, evaluation-related resources. This is a digital archive. It's a Google Drive, actually, that you can access from the Mental Health Board's website. This year, we didn't add a lot to it because most of the measures that we were working with programs to develop were sort of unique to their programs. They weren't, established measures. We continued to offer consultation bank time. This was time-limited consultation to programs that wanted it, who were not our targeted partners. We had 2 programs that took us up on that this year. For one, we helped clarify anticipated short-term outcomes of their program and help them to operationalize the program components of their program. And the second, we worked with them. They were going through staff changes, and we worked to clarify the evaluation strategy that they had developed in the past for the new staff, and assisted them in using the Excel spreadsheet that we created for them to analyze some data and to update that. So those were a couple of examples of consultation bank work that we did. And then we get to the meat of really the bulk of what we did this year and have done throughout the years, is work intensively with programs throughout the course of a year, where we meet with them, many of them weekly. We encourage them to meet with us at least twice a month, every other week. And we had 3 new partners this year. We had the Well Experience and Women in Need Recovery that were funded by the Mental Health Board, and then funded by the DD Board was the Champaign County Regional Planning Commission's Decision Support Person-Centered Planning Program. We had, and those were, I'll say a few words about what we did with these programs in general. We had 3 continuing partners. These are partners that we had worked with in the past in this intensive way, and then worked with again this past year. One was Community Choices Community Living Program. We've actually worked with them for more than 2 years. They were really gung-ho and very interested, and they worked on a couple of different programs. We worked with RACES, Sexual Violence Prevention Education Program, and with Uniting Pride's Children, Youth, and Families Program. And the goal of these continuing partnerships were to really move them from collecting data to using it to inform programmatic changes and to communicate their findings to various audiences, including the Mental Health Board. And here's a brief summary of some of the activities that we engaged in with partners. As I mentioned before, we worked with partners to create theory of change logic models and or refine them. That's a common task even for a model that is brand new. As you dive into the details of trying to establish a strategy for evaluation, you find ways in which the model is not what you thought it was. It's not as effective as you thought it was. And so we were refining program logic models. We worked with them to identify and tailor for their own program use high quality, empirically based measures of key constructs in their programs, including measures of access to and barriers to program participation, as well as implementation and participant outcomes. When those kinds of high quality empirically based measures were not already out there in the literature and being used by others, we created new surveys and measures of key program constructs. As I mentioned, that's what we primarily did this year. We developed standardized data collection processes, data storage processes, and analysis procedures with programs. We identified appropriate benchmarks for interpreting program impacts. Now you get a bunch of data and you're left with the question, what does it mean? Are these good outcomes or bad outcomes? How do we decide whether we're making sufficient progress or change in people's lives? And one way to think about that is to go to the literature and look for what is a typical change in a program that is considered successful, and use those as benchmarks against which to evaluate progress that our own programs are making. And then finally, we help to support programs in data usage to improve programs and again, share program challenges and successes with various audiences. And then our final 2 goals, one was to meet with the board members or staff and to provide information and consultation as requested about evaluation. This year, we spent some time, and I expect to spend a little more time with Lynn over the next weeks, consulting about how the staff can continue to support evaluation related work for the boards. And that might be provided in the future, since our work with the board is coming to a close now. And our final goal was to offer workshops related to data usage. And this year we focused on Excel. Those two workshops were sequenced so that one built on the other. They were attended by 5 agencies: Races, First Followers, the Refugee Center, DSC, and GROW. And I'll just show you a few things that we covered in those. This was really, not for people who know how to use Excel. It was really intended to sort of break the ice, encourage people to start to exploit. Excel is an incredibly powerful tool, and most people who use it well only use a small portion of it. But so we were trying to show them how to use it for creating their performance outcome reports. We showed them how to create a workbook, add sheets. You can see this list here. I'm not going to read it all, but it was to get the basics of how you navigate your way around the program. And then in the second part, which we offered a week or two later, we provided practical demonstrations of how to use Excel to answer the questions on the quarterly and annual reports related to performance outcomes. So we help them identify the key tasks that the performance outcome reports are calling for. We helped them answer a few, or demonstrated how to answer a few questions using sample data. And we introduced various tools in the Excel program for common tasks that are required in the performance outcome reports, calculating the length of time between, admission and first assessment or something like that, computing means and percentages, tracking change over time, breaking out results separately by defined groups, things that are pretty common in the reports that you all read each year. So that's all I have for you tonight. I just wanted to give you a brief overview. The details are in your packet in our report. I would, if you haven't had a chance to look at it already, tell you to skip the first section, which I just gave you the overview of, and to focus on the sections 2 through 7, which are the detailed reports that we provide for each program that we worked with, each targeted partner that we worked with. And there you can really see the sort of logic and the flow over time of the work that took place. So I'd be happy to answer questions or comments, and happy to not do so if you want to move ahead, as I'm sure you feel pressed to do with your long and busy agenda. So I'm going to stop sharing my screen here. And
Mark, I have a question.
sure.
I was just wondering, first of all, thank you. I think this has been a very useful program, and happy retirement.
Thank you very much.
I was just curious if over these 7 years, the landscape of services has changed in ways that changed what you were doing, or what, or how we should think about evaluation capacity building when we, look for another provider.
That's a great question, Elaine. I wouldn't be at all surprised if, in fact, the landscape of services has changed, unrecognized by me. I think the way we have designed this project is that it really wasn't driven specifically by the types of services that are being provided, as much as it was intended to communicate general skills and approaches to gathering data and making sense of it. And that could have been done with, organizations quite different than the ones that we worked with. That said, I do think that one area that we did not do much work on, and I think there could be really useful work to come, and that would be to get more narrative descriptions of the experiences of program participants. We focused primarily on what we call quantitative data, data that is numerical in nature and that it's possible to aggregate easily and meaningfully into, summary statistics, that kind of thing. And I think there are, and we focused on that because that kind of evaluation is more foreign and was largely lacking in the programs when we got started. And people were already pretty sensitive to and keyed in on trying to tell the story of their programs, what the important goals of the programs were, and then they could find some key participants who benefited, and they could really show the changes in their lives. And I think we've, taken a step away from those rich narratives, and I think we don't want to do that. We want to make sure that those get incorporated into future narratives.
Could I just say, Mark, you have provided a beautiful segue into the next agenda item. You might not even realize that. But anyway, back to the board questions.
I didn't realize that, but I'm glad that happened.
Thank you. That's a very useful insight. Thanks.
Sure. Matt.
Yeah, kind of follow up, first of all, to echo what Elaine said, great work and best wishes for retirement.
Thank you.
But before we completely let you go, I was curious, and maybe this is part of what you're gonna be working with the staff, because we've gotten these yearly overviews. Is there any plans to put together and tie everything, all 7 years together and with an ISPO or something, kind of what Elaine said, how things have changed over the 7 years, what you just mentioned about what might be good plans going forward for a future. Basically something that in a year or two, we could go back and look at everything from a 30,000-foot view.
I think that would be an interesting project. There would be lots of different ways one could do that. That's not on our agenda at this moment. I think that we could do that, or and I think it might be also useful to have somebody who has got fresh eyes come in and look at what we did and reflect on whatever they see in terms of change over time. We did at one time, about midway through this 7-year process, survey staff in the agencies about their experiences with our work. And we did report that out at the end of one of the years. I can't, to be honest, can't remember exactly which one it was. I think it was the 4th year. And we have a graduate student, I mentioned at the top, Hope Holland, who has been a regular graduate student assistant on this project, who is going to do a dissertation. Her dissertation is going to focus on the experiences of key stakeholders in this system with evaluation. And in a way, that will be a reflection on the past. And she will share that. She wants to share that with the board and with the agencies when she completes that. So that's not exactly what you're asking, because it doesn't focus on our work in detail in explicit way, but it will definitely reflect, her findings should definitely reflect changes over time in the experiences of the programs with evaluation.
Okay, thanks. And actually, I was wondering if that would be part of it, was a dissertation or something that you would, for your own academic reasons, put something together, let alone for us. But okay, thank you.
You're welcome. Thank you for the question.
How did the pandemic affect some of the data collection and things like that?
It's a great question. I think it did. We really noticed over these last couple of years that programs were really not struggling, but they were stretched in ways that made it harder for them to focus on evaluation. You know, this has been I would say a constant in our work with programs that they, and you know, I completely understand this. When I worked in programs like the ones that you fund, I had the exact same experience of wanting to do more service provision and not waste our time, so to speak, on collecting data that would never, you know, really get used. And, you know, I've come around on that point. You know, I now believe it's an ethical imperative that programs pay attention to what they're doing and be able to speak to their outcomes. But it was harder for programs for sure during the pandemic, partly because of all the demands of having to deliver their services in new and creative ways, but also because the pandemic really, as you all know, has really hit the workforce hard. And many of our programs are struggling to stay up fully staffed. And even with turnover, even when they're able to replace valuable staff, there is, you know, 2 steps back on the institutional memory and capacity. So I think it has been a challenge for sure. And I think it partly accounts for why we ended up working with continuing partners more in those last 2 years, because those were programs that had already had a running start and could build on what they'd done before, rather than, you know, sort of have to wrap their heads around this brand new.
Thank you.
Sure, thank you. I hope we are getting out of this. I think we're finally making some progress, but doesn't feel certain to me. So.
One more quick, hopefully quick follow-up. Oh, sorry.
Sure.
But it was mostly, especially talking about the pandemic, but the workshops and stuff you mentioned. Did we happen to get those recorded or anything that we could put on that toolkit that you mentioned?
Yes.
Perfect.
In fact, they're there. They have been recorded and they are already there.
Awesome.
The logic model workshops, not. We didn't record those. I think we have done that in the past. I'm almost certain there's one up there. Because we do that, we've done them repeatedly over the years, and there's no sense in really doing them all. But the data workshops, for sure, we did 2 different data workshops in fiscal year 21. They're up there, and the 2 we did this year are also there.
Perfect, thanks.
And those,
and again, probably the most important thing that's there, I'm sorry, Lynn, to cut you off, is there are resources that are listed that you can go to. You know, these are really introductory, scratch the surface, get you know, in the door kind of thing with Excel. They're not really tutorials on how to exploit the full powers of Excel. Lynn, I'm sorry.
Just to say that those are, those are both links are posted on the public page of our online site. I'm trying to get to the page to show you. Oh my gosh. Sorry. Anyway, I just showed a lady today. Here it is. If I can share the screen just for a second to show you, we're trying to post some, you know, content that's especially important to the public and the agencies on this website that was created for the agency application. This first page is all public and everything in blue is a link. So you get down here and here are the program evaluation support is the resource bank that you've been talking about, and related workshops are the workshops that were done this year. So this is not easy to find for people. I think the links are kind of long, the actual hyperlink is really long. So you know, this is just sort of a constant thing for me, like the information that I think the public should see, you know, and I try really hard to make it easy to find, and then it's just not. So sometimes the best thing is just to email it to people. Anyway.
Thanks, Lynn.
Hi, Mark. Thank you very much for your presentation. I wanted to write on the back of something you shared earlier, which had to do with your experience, you know, when you were working with programs and how the focus was more on the services rather than engaging in activities that collected data and all of that, and how that has changed. And I was wondering, like, throughout the 7 years you've been working on this project, if you've encountered some of the agencies that had that position and how over time that might have changed, and what strategies or approaches your team took to gradually win them over, really to see the importance of evaluation. Thank you.
Yes, that's a great question. Thank you. We were really concerned about this when we first launched this project. We were concerned that programs experience evaluation is partly useless, and worse than that, they experience it as punishing. So it's something that evokes fear and trepidation. People don't want to expose what they think of as, we all got them, dirty underbellies of our, whatever it is we do. And I think there was a lot of that kind of concern. And so we spent the first year of this project not doing what I described to you today, but really doing preliminary work, listening to the board, listening to the programs and agencies, and trying to gather, develop a perspective on what it was that they were already doing about or with evaluation, how they thought about it, and inviting them to shape this project, help us decide how to do it. And that work led us to focus on evaluation capacity building rather than evaluation per se. We were not aiming to go in and evaluate the outcomes of the programs that you fund. Instead, we were aiming to help programs develop the skills, create the resources, identify the strategies that they might benefit from using to collect data to inform themselves about their own work. And we try to emphasize that this is really it's for them as much as for any, it's in the best interests of their clients, their program participants, to know that the activities you're engaged in are actually linked to, in a meaningful way, the outcomes that it's a pretty simple idea, but it's something that sometimes gets lost track of when programs are very busy and very pressed to see another client. And so I think I'm saying two things. One is that inviting program staff to take ownership over the data collection process, to decide what it is, what kinds of questions they want to answer, what questions do they have about their own programs, what are they worried about not working, what are they proud of and are pretty sure they can demonstrate that they're doing something right well. Having them own the process, I think it was the most important thing we landed on. And that has, I think, serves us well over the course of the 7 years. And I think the presentations that the programs have done with each other after serving for a year in these partnerships has also sort of made it a little more human. The process, it's exposed some of the warts and of the process. It's not all pretty perfect data at the end of the day. And it doesn't always answer the questions in the ways you would like to have them answered, like you would have a blind trial, that's a double blind trial. That's not what we are able to do or encourage programs to do, because they don't have the resources to do that kind of evaluation. So figuring out how to make use of some fairly straightforward, simple data was an important approach we took as well. But that's a great question. I think there's a lot more that could be done. I just, that's what I know that we've done so far.
Thank you.
Sure.
Thank you so much, Dr. Aber. We really appreciate all the hard work you and your team have done. Again, congratulations on retirement. Definitely deserve to enjoy it. So
thanks. Well, I appreciate all the work you all have done and the opportunity to work with you. And I'm not going away from the community, so you'll see me around. And thanks for all your support over the years.
Thank you.
Okay.
So,
Take care.
thank you. So, the next item is going to be the youth and staff participant survey. Lynn, if you want to talk about that. I think you're on mute.
This is all to the credit of Liam Bryson and Kim Bowdry, who worked with an intern from Humanities Without Walls this summer. Kim also developed a survey, but we did not include the resulting report in this board packet. It was specific to adults with developmental disabilities who are doing self-advocacy work. So we probably should have shown you that. The results of that one will end up in the priorities document that I'm going to present next month. But I think this is just so cool because it's what Dr. Aber was looking for, and here we are doing it. And so this and the next agenda item actually were heavily influenced by the new guy, and I can call him the new guy until we get another newer guy. So I don't know if Mr. Bryson is in a space where he can talk about this, but he also did something really amazing and put charts in his memo. There are charts. So anyway, I'm going to be quiet. And if you have any questions for him, I thought the memo was actually pretty self-explanatory and nicely organized. So I will mute myself.
I can take questions or I can say something if you want. Had a lot of fun administering the surveys, meeting with the kids, the youth, and the staff. Got great feedback. Once I was able to get the youth to settle down, they were very, very opinionated about their experience with the summer programs. And they enjoyed the programs. They enjoyed working with the staff who were very engaged in the activities with them. The youth, as we all know, enjoy simple things like swimming, ice cream, going on field trips. The staff really enjoyed what they do, and that was because they had the support of the program director. So shout out to all of the agencies who have solid program directors. You are superheroes in the youth's eyes. Staff felt supported. They felt like they could make changes when necessary, and they felt that there was room for professional development, professional and personal development. And so this was a great little opportunity that I got a chance to be part of. And yeah, it was just an awesome moment. We had about 5 agencies participate in it, and staff was very engaged along with the youth. And so just, when we talk about narratives, this is really telling us some things that we need to know about what's going on with the programs that we fund, Mental Health Board fund. So thank you.
Yeah, I mean, like you were saying, it was a great, nice little section in the middle of this packet to read. Even though it wasn't, I mean, there is some quantitative, but it's about subjective feelings that people have about the programs, including staff and the people that are participating in it. And it's just really nice to see that, from a subjective perspective, there is a positive impact being made, which is great. And that's what we want to see. We don't want to just see, numbers on a page. These are, people's lives that we're talking about. And so it's awesome. I really enjoyed reading this.
Thank you. The moment I said to the youth that we want to hear your voice, that's when the floodgates opened. Everyone speaking. They started working with each other on their surveys, and so I had to split them up. But it was well worth it, and so thank you.
Yeah, there is a story behind the numbers. The numbers can tell a story, but when you actually hear the narrative behind the numbers, it makes a lot of sense, puts it in place. Thank you for doing that.
And I think next is another memo from Mr. Bryson from Leon on the 3-year plan draft objectives.
This was kind of fun. We did for the first time ever, we used a chart and kind of a formal process to evaluate each objective. And we did it as a group, and then Leon put together the summary, but you'll see these, so the plan is set for 3 years, so we don't change the goals, but we've created quite a few revisions to the objectives, and some of them are just like I hate this term wordsmithing, but for me, it was trying to frame things in a more positive way, or to shift the focus onto the person receiving services. So, there really were grammatical changes around trying to accomplish those two things. But then we also were asking ourselves, like, how do we measure this? Because so many of the goals are infinite. So what are the things that we're doing, and how are we doing with them? And okay, again, I will let Leon take it from here, but it was a fun process for me, at least.
No, Lynn, you speak volumes. That's exactly what we did. We spent a lot of time wordsmithing, and Lynn is the wordsmith champ, just so you all know. We spent a lot of time taking a look at some of the objectives, making some minor but major important revisions to the objectives. And so at some point, we will be presenting these back to the agencies for their feedback, and then ultimately to the board. For final.
I hope you send it out tomorrow.
Well, okay, tomorrow.
Because we would like to present the board with a final draft in November, at the November meeting. So we'll need to get feedback during October. And I would also invite board members who are interested, if you want to comment on anything in here, to please contact us. Especially during October, that's when we'll be looking at the revisions again and taking input. We may even have more staff ideas during that time, but we hope that the draft you see in November is a final draft. That's the goal. So.
All right. With no other comments, I guess we can go on to the agency proposal for 2023 funding.
So this is during the normal allocation period. There were a few board discussions about one of the Rosecrans applications. It wasn't even a particularly large program, but just the question was, could it be refocused to address the needs of young people? Like prevention, substance use prevention is great, but like some of our board members are actually seeing a lot of young people with very serious support needs. So the agency took some time and submitted a mid-year application. I did a program analysis of it here, shared with the agency. A few questions that I had gotten from board members. The agency responses are actually in here. And then after I shared this final draft, there were no more responses from the agency, and maybe, they might want to respond to it today, but I turned this around kind of fast. So I hope that it was adequate. And then my recommendations are presented here. So, but it's one recommendation anyway.
So just to clarify, they are requesting $79,576 for the program, but we would be funding $59,682, correct?
Mm-hmm. Because it would be, that's 9 months of a 12-month, and the 12-month amount would be the 79,000 that they requested. So hopefully a program could, like the contract could start October 1st. It's pretty quick, but I think we can do it. So it would be a full 9 months.
And, just for a little bit of background, since I do see a lot of these patients, If you have Medicaid, I mean, even if you don't have Medicaid, the wait list for seeing a counselor is months. I mean, you're looking easily 3 to 6 months to get in. And that's even if you have something severe that's going on in your life. And if you're Medicaid for a child, a teenager, the main places that we will refer, other than like Carl, and again, Carl has a long wait list for the counselor for people with Medicaid, is Rosecrans, ABC Counseling, and Hope Springs. And even with that, the wait list for all those places, it's a long wait list. So it's not easy to get in just because there's such a high demand, and there is already a healthcare provider shortage before all of the pandemic. And this just kind of exacerbated the amount of mental health need in the community and nationwide. And so it's just trying to fill that demand. And so even, I'm sure once they start, they will be full within a day. I'm sure their schedule will be packed. So.
So do you want me to put it back up on the screen?
Yeah, I think we move for a motion first, and then we have a discussion, correct?
A motion to approve funding in the amount of $59,682 for Rosecrans Central Illinois Child and Family Services are presented in this memorandum. So let's talk.
And I'll
I
second
will
the
second
motion.
that.
Or Jane can second that. All right, so let's have a discussion.
Well, I mean, I totally agree with Dr. Yukim. I mean, the need is so great. And if we have someone who can provide this service, and, we as a board had asked for a couple changes in their original, request. I think that we need to follow through because, lives are at stake at this point.
All right, well, seeing no other discussion, we can move to roll call.
Matt Hausman,
Yes.
Daphne Maurer, Daphne, Alexa McCoy,
Yes.
Molly McClay,
Yes.
Joe Omosage,
Yes.
Elaine Plencia,
Yes.
Jane Sprandall.
Yes.
I'm going to go back to Daphne Maurer.
Yes. And I think it's $79,576, correct?
No,
It's 9 months worth of that for
Okay,
the funding.
Okay, then yes.
John Paul Yukim,
Yes. All right, so seeing that's approved, the next item on the agenda is the agency request for an extension of the audit deadline.
So I did not prepare any information to introduce this. Received it in time to get into the board packet, but this board has the authority to make a motion about, related to this or have any discussion. And I believe the representative from the agency here, and while I don't know about this case, we have observed especially some of the newer agencies continuing to have difficulty securing a CPA to perform the independent audit, just the same kind of problems that we saw last year. So I'm not surprised to see this, but I do not know if that's the case here. I'm not sure what the delay was about. We haven't been tracking the situation as we have with some of the newer agencies. So anyway, that's all the context I can provide.
is Jennifer, the director with Promise, so I can provide a little bit more. It is very much that we chose a new audit firm this year, and so that takes longer. And they were busy too, and staffing was an issue. But it was previous problems too that continue to cause delays. So it's not new, but it is kind of similar problems. We feel like we've made good progress, but it's just disappointing to hear under these circumstances. And I appreciate the time so much because you have a very full agenda. So I'm regretful. I just really want to stress that we continue to serve patients. We are seeing everyone that comes through. We actually have one therapist who can see adolescents, and we've increased her time to 2 days to that. And we've hired another adolescent behavioral health therapist to help us. And our psychiatrists have a turnaround time of a new patient of the same day or the next day. They will see absolutely anyone coming through, which is extremely rare to find, but great for our community. So they are dedicated staff. And so while we work out all these awful kinks, which we know that we will, and we will get through it, the services still continue, and they're just doing fantastic. And we will continue to support them. Even one of our psychiatrists had planned to retire at the end of the year, but knowing the great need, he said, I think he'll stay another year, which is awesome. So we're really grateful for that. So I appreciate the time and your consideration in this.
Jennifer, do you have any kind of an estimate as far as, obviously we said can't make the 30th, but anything about like where you're at roughly in the process, and then what you think as far as any kind of prognosis? I realize you can't predict the future, but
it's really, Clifton, Larson, and Allen, they are sticklers, and that's what we wanted. We really wanted someone who would go through everything and find where we needed to make improvements. And so when I've tried to do the same thing, I said, this board is going to ask me when we can have this done. Can you give me something? And they're like, well, we're working on all these other ones too. And so they approximated 6 weeks. They have all the information that they need from us. Jamie is here, who's my new CFO too, who's been helping with us. And so she's been very responsive to any question that they might have so that we can speed things along. And I also have a board member here tonight if you had questions for that. But at least we hope that maybe it's even less than 6 weeks.
thanks.
I just want to say that I was glad to see you had hired a CFO, because when your application came through this last year, that was a question I had about the way things were set up. I didn't know where some of the information was being controlled and coming from, the financial information. So I applaud you for doing that. I think that'll be a help.
And she has a lot of great experience, years and years, and she's just been awesome in the short time. We also, it's not ideal to have consultants, but we did go with a national firm, and Clifton, Larson, and Allen applauded us on that to say you did a good job of bringing in Whitley to help you get things in order. So the two of them have worked well, and then adding Jamie, and we've added another an accounting manager and someone to do payroll. So we are bringing in staff for this.
Okay, good.
I have a question for Lynn and potentially Chris. I probably should have asked it before tonight, but I just thought of it. I always feel like poor Jennifer, and I've apologized to her. I don't ever want to come across as the ogre, but is there anything legally that our board is very compassionate and we understand the situation. They've hired, help. I mean, are we bound anything legally to a certain point where we have to say, enough time? Because again, obviously we've got federal funds and this is county, so I don't want to get us in a situation. Is there anything like that?
Well, so your funding requirements, we adjusted them a few times a couple of years ago to try to help this situation, but maybe we didn't adjust them enough. So you do have some freedom. it's just that the longer you wait for an audit, the longer until we can finish our job of accounting for whether the funds were used appropriately. Like it's some audits like are a year late, you know, or a year after the program year. And so it becomes harder for us. Like we're never in a season of evaluating audits because they come all the time. They're, you know, when they're late, this just sort of drags this activity out for us throughout the year. So it's what's gets stretched is our ability to account for things well. So that's not flowing from the statute. But the other thing is there is a risk. And we were just holding payments for, in fact, for this organization, we held payments for over a year. That's a year plus of payments. So they ended up being attributed to different budget years for us and for the agency. So that isn't really, that's also not tied to any statute. It's just a risk that agency takes. We have a contract, but the payments are paused and they're still delivering services for 2 years and not getting paid for any of them because the audit is delayed and they might never get paid. You know, like that. So this board made the decision to reduce the amount of time that we would hold the agency to perform the services under the contract, to do that for only 3 months. So if the agency is asking you, can you keep can you keep letting us do the service and just hold the payments until we get the audit done? They're taking the risk. They're holding the risk. You're not. It's just, it's like it kind of, you know, it kind of don't make a huge deal about us having to do this accountability stuff all year long. That's really not a huge big deal compared with other impacts of the workforce shortage and the shortage of accountants and the burden of reporting requirements and how, you know, turnover at every level in the systems of services is really creating chaos now. Like our inconvenience is nothing compared to that. But anyway, I don't know if that was helpful, but it is your own rules. So I think you have, if you want to create exceptions, you can. I can't.
So just remind me, so currently the funding will be held after September 30th? Or is it already been held?
The funding has been held. The audit was due June 30th. The funding had been held for July, August, and September. Per the funding guidelines, the contract will be canceled October 1st. And then the agency would not be under an obligation to perform the services anymore, and we would not be holding payments. So if you create an exception, they can continue to perform the services and we can continue to hold the payments. I mean, I don't know.
So we would have to move for a motion today to extend the exception for the audit until, say, December 1st, to give them enough time, even though that's a little more than 6 weeks, so we can get the audit in at that point. Do you think that would be reasonable?
For me, that would be grateful. I mean, for promise, that would be amazing. So that's very gracious.
And then the plan would be to still to withhold the payment though?
Yeah, that would be the plan. I'm not sure what the rest of the group thinks. Lynn, would that be something that we would be able to do, correct?
You absolutely can do that. And I think, like, I'm sorry that we're still living in times where this is an issue, but I think it'll happen again this year. Not to this, to another agency perhaps, so. Yeah.
So do we need a motion in order to do that?
Yes.
I had been thinking the same thing. about sort of the timeline of something around like the end of November, beginning of December, that would give a little bit more than the 6 weeks, just in case things take a little longer.
Do we even want to go even further than that? Just
January 1st.
that, yeah, just given the nature of things.
Yeah.
I don't need to have an emergency meeting during Thanksgiving. Is that what you're saying?
Yeah, because I prefer not to have to do this again.
Yeah.
And at one point, didn't we also need like Promise Healthcare's their board to approve the audit before we can accept it? Is that correct? So
Right.
maybe January 1st would be advantageous. And
Or
I
December
do.
31st.
Yeah. I totally recognize that, you know, they're providing the care with no money coming in. And so, you know, they're at risk, but as long as we get our paperwork, I think we're good for it. So.
Yeah, I agree with Jane.
Well, but after we get our paperwork, then we have to look at it. And there are, you know, sometimes an audit contains information that causes you to stop the funding anyway. Not saying, I'm not, but
Don't say that, please.
that's just an aside. That's a different.
Don't do that, Jennifer.
Yeah, I think Jennifer and Davey will just be like, I give up at that. I think they're trying to get all the ducks in the row, so don't throw any ugly ducklings in it.
Would we want the due date to be, oh, sorry, I didn't know if somebody else was talking. Sorry, would we want the due date to be mid-December? Because then we could review at if there is a board meeting in December. I've seen there's one on the 21st, but it's tentative. But then it would give some time to look at it.
Yeah, I think January 1st would probably be the easiest deadline. This way it just gives us that time.
Yeah.
Do you want to time it, the deadline for audits for people or agencies for the fiscal year that ends on June 30th is December 31st?
December 31st.
So it could be that, like that would be consistent with the audits due for the other fiscal years.
Okay, I think that sounds reasonable. All right, if everyone's cool with that, I will. I'm gonna move to. I'll move for a motion to extend the audit deadline for Promise Healthcare to December 31st, 2022.
I second that.
Any further discussion? All right, seeing none, can we have a roll call?
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Alexa McCoy,
Yes.
Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Palencia,
Yes.
John Paul Joachim.
Yes.
Just one point of clarification, Lynn, just don't make, so that motion that we just passed, that's enough. We don't need to do anything else about as far as the program funding or anything like that.
It's good. We'll continue to hold payments until the audit, and if there are big problems with the audit, we'll deal with that later, but I think it's just the timing, so, okay. Thank you.
All right. So I guess the next thing would be to move to. Wait, am I missing something?
Oh, yes.
The old business, sorry. 2023 budgets.
Yeah, thank you. So I talked to an anonymous board member yesterday who said they hated this memo, that it made them mad, just because the level of detail was so nauseating. Like this, you know, what we've got here is in the summer, the mental health board and the DD board approved the first set of budgets. This is the way we do it every year. We want to get your approval before we present a budget to the county board, because the mental health board and DD board have the authority over their budgets. So we show the county board your approved budgets, and we get input from the county board and also from county administration. So the kind of input we got from the county board this year was, good job, you're doing great. But the input from county staff is very detailed, really good news, which is there is a greater than expected property tax revenue for each board. So that changes. That's the main revision to the budgets. And then we have to figure out how we're going to spend it. So typically that increased funding goes into the contributions and grants line to support agency allocations. So that's what we did. But then there were a lot of other changes that came from the county related to our staff expenses and costs that we pay, the services and insurance, things that we pay to the county. So lots of little details like that. But then maybe the nauseating part is that the county has implemented a new accounting software and also changed all the categories. So all the categories aren't like the most compatible with how we've described our budgets. So I tried to just capture all those changes to show you, like, a lot of things are lumped into one category now that were separated before. We have to use these categories, but there's no reason for me not to tell you what's inside them. So this summary just explains all the different lines and all the changes related to the cost and revenue projection changes. And then this document, this is the first budget that I would ask you to approve. And then the second one is the SILA fund. But the background information for all of these is still here, and it continues to describe things in the kind of detail that the mental health board asked me to provide about 6 years ago. So I can continue to do that. It's no big deal. But the new accounting software, this was our first year with it. So we had to use certain lines that maybe they're not descriptive. They don't make that much sense. Maybe next year it'll be a little better. So those are the first two documents. Then another attachment is the intergovernmental agreement between the two boards, just to explain the cost sharing, which is, that's also included in here. And then finally, the documents that were presented to the county board, because I thought they were one of the new software systems that they were using this year created a really beautiful and easy to look at set of board documents. So that's the last attachment in this section, and they look like this, and they're just nice. So you don't have to do anything about those. It's just more information. But I was just kind of celebrating because this was not easy for county staff to put together. It was a really tough summer for them. These new systems were much harder to deal with than people predicted. So anyway, that's my not very summarized summary of what's going on here. Do you all have questions about this? It might be the last time I show you revisions, because they've the day that Stephanie and Kim were putting this board packet together, we got the health insurance projection, and I was able to put that into the document as well. So these numbers are the most updated I could expect at this time of the year, and they might be the last that you have to see.
I mean, I guess this doesn't have to do with the budget, but like on page 90, I thought it was pretty cool to see the performance indicators.
Oh, okay.
And see how many people served who have like a mental health or substance use disorder or developmental disability. I thought that was really cool. And number of funded organizations, and it showed like the actual one for 2021 and what our projected was for this year and our budget for next year. So it was an interesting read, but very, very lengthy. So.
Yes. Well, I think this chart is kind of cool too. So I'm glad you noticed that. I hate to just always put so much information in front of you, but this one was, it was a miracle that they were able to pull this off. That software failed them like 5 times with our budgets. They never have to spend this much time on our budgets. And so it was really hard. I went down to the county administrative offices and worked with them on it. I wasn't feeling real well that day, so I kept my mask on, and I had COVID the next day and managed somehow to not make anybody sick in there. So it was this budget means a lot to me. Sorry, but I understand that the detail could make a person mad.
I think I'm used to reading science papers, so I think it doesn't bother me as much, but yeah. So I guess the things we have to do is just approve the motion for the expenditures. So if there's not any discussion, I will go forward with that. So I'll move to approve the attached 2023 CCMHB budget with anticipated revenues and expenditures of $6,369,010.
I'll second that motion.
Any discussion? Seeing no discussion, we'll move on to roll call.
Elaine Palencia,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Alexa McCoy,
Yes.
Molly McClay,
Yes.
Joe Omo Osagie,
Yes.
John Paul Joachim,
Yes. All right, and then the second motion is to approve the attached. So or I guess we can talk about it first. There's a motion to approve the attached 2023 SILA facilities fund budget. I don't know if there was any other comments on that before we move to the motion.
The revision to that one was really simple. We just we're projecting investment interest, which we hadn't included before. So that just increased the revenues by $1,000, and then we're going to spend that $1,000 again on professional services.
Sounds pretty straightforward. So I'll move to approve the attached 2023 SILA facilities fund budget with anticipated revenue of $51,000, use of $300,000 from fund balance, and expenditures of $351,000. Payment to this fund is consistent with the terms of the intergovernmental agreement between CCDDB and CCMHB, and full approval is contingent on CCDDB action.
I'll second that.
I apologize. The extra expenditure won't be professional services. It would be in allocations to agency contracts. I'm so sorry.
That's okay. Oh, and then I guess the only other question I wanted to ask you was, did the CCDDB board already approve this? I'm guessing. Okay. Any other discussions or questions? No. Seeing none, we can move forward with roll call.
Daphne Maurer,
Yes.
Alexa McCoy,
Yes.
Molly McClay,
Yes.
Joe Osagie,
Yes.
Elaine Palencia,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
John Paul Joachim,
Yes. All right. The next item on our agenda is the 211 second quarter update.
This sure is a nice looking report. I wish you could see it in color, but we had a little trouble with the copier this time.
You know, I saw that the biggest thing obviously on here, if you look through it, is housing. And I don't deal with this, but I was wondering who helps with the housing assistance in the area? Is it just the housing authority with the vouchers, or is it anything else? Anyone else that helps out with rent payment assistance? Or
I think the Regional Planning Commission has rental assistance too. I don't know, I didn't notice, well, maybe here. So here, I would imagine that these are actually all housing related referrals in these top 10. I've never heard of this last one, St. Vincent de Paul.
St. Vincent de Paul, I think that's part of St. Patrick's Church. They have St. Vincent de Paul is their, I thought that's their food pantry.
Okay. Well,
but I
these,
don't know.
all of these entities do work related to housing supports. So I think this is your answer, maybe.
Yeah. And I think it's in the state of Illinois that you starting January 1st, you cannot deny any vouchers. Is that, I think I heard that somewhere, that you can't, because some landlords deny vouchers from the government or from different agencies. So I think I started January 1st of 23, you cannot do that any longer.
So thank you for bringing that up. I think we want to bring you a study session on services for people with unstable housing in late October. It's a good time to start thinking about it.
Yeah, because I mean, here at Parkland, we do have students who house, I mean, pretty much couch surf. As a couch surfing as a student is really a difficult thing.
I also like the stories they shared about the different people that they've served in the community. Kind of just brings more of a narrative to it than just numbers on a page.
Yeah.
All right, we can move on to the next item, which is the Expo update.
I don't know if Kim's in a position to speak to y'all. She doesn't like to talk a lot, so it'd be more time saving than if I do it.
Hello, do you guys have any specific questions for me? Things are moving along rather swiftly with the expo. We are just a month away. I think the biggest thing is that we are in need of volunteers, and there will be a Sign Up Genius link that will be shared soon. I know that the expo advertising is taking off. I know the buses are going to be rolling out with the I guess the large posters, and I have seen the expo ad on Smile Politely as well. So if you have any questions, let me know.
So you just go to the disabilityresourceexpo.org to sign up for volunteering?
We don't have the link yet. I think they are still working on it a little bit. I'm sure we will share it with all of you and request that you all send it out to all of your contacts once we do have that link, because I know that is our biggest need right now. You won't get away with not getting the link, I promise. No one is free.
And I definitely feel like with it being at the mall this year, even just extra people who just happen to stop by for a little bit and can help guide people will be appreciated. You know, there's been, as you can imagine, plethora of conversations. One concern is, you know, even safety at the mall. We are responsible for our own security. So I'm asking you men, come out and be like, hey, quit horsing around, kids, because I am a little worried about that. So but we'll get it taken care of. But yeah, I'm like Kim. It seemed like it took forever, everything that could go wrong went wrong, and now it's like, oh my gosh, it's in a month. And like, I picked up my decals for the cars today, so everyone's getting very excited.
Great.
I always forget, when is the Marketplace Mall farmer's market. Is it Saturday or Sunday mornings?
Oh, Marketplace? Marketplace has a farmer's market?
I'm thinking of Lincoln Square.
Lincoln Square.
Oh my
Yeah.
goodness, my mind. Sorry.
It's okay. It's a long day.
All right. So I guess the next thing is the schedules and allocations process timelines.
I know this is everyone's favorite part of the meeting. They're in there.
And then we can go on to agency input. There's any agencies now that want to make any comments or ask any questions.
I think, John, you're muted. John, are you trying to speak? I think you're muted.
Oh, sorry. For some reason, it wasn't working. I was trying to unmute. Sorry. So I guess the next part was the agency input. If there's anyone that wants to make any comments from agencies. Seeing none, we'll go on to staff reports, or sorry, CCDDB input.
Just very similar to your agenda today. They had an agency request. They had a report from Kim on the survey that she conducted of self-advocates. The information, even though it's not a large number of people, the information was super interesting, and it's going to make its way into your priorities document because it helps us a lot. It is a miniature needs assessment, but it's good. So anyway, otherwise, and they approved budgets, and they're on track to meet with you next week at the study session, or not a study session, joint special meeting to talk about the future of the outcomes project. Like, should we do it again with a different research team? The future of the SILA fund, which is now called IDD Special Initiatives. I have a final draft of a priorities memo. Both boards have seen it. So anyway, you'll see them next week. That's all I have to say about that.
All right. And then the next part is the staff reports. Obviously, it seemed like staff was very busy since the last meeting.
We've been getting into everything.
Mm-hmm. All right. There's no comments or questions. We can go on to board reports.
Yeah, I have one. The last two community coalition meetings I have attended, and I was sitting next to Pat Egge, and after the last meeting, we agreed that over the years, those meetings have picked up energy, and the kinds of information we get and the kinds of programs that are continuing and are being founded seem to be more intentional and more targeted. So I think it's working. I think the coalition is working. I think there's a synergy that has developed. I feel like it's taken a while, but I think there's a different mood than there used to be from what I sometimes thought were kind of pro forma reports. But I think that our involvement in that is a good thing and has gotten better and is useful to the communities, to the agencies. So Just wanted to bring that to you. Yes, there's Pat.
All right. And then any board announcements? All right, seeing none, we have, I guess, other business. So we have the review of closed session minutes. So I guess board staff and attorneys request that the board continue to maintain as closed the minutes of the previous closed session, which have been distributed for review. The board may move the board to an executive session when if we want to, when the closed session discussion finishes, a motion to return to open session. Okay.
But if you don't need a discussion of the closed session minutes, you could, someone could just move to accept them as presented and to continue maintaining them as closed. If you do want a closed session to discuss the closed session minutes, I will get out my other computer and I can share a link to do that over there, but then you'll have another set of closed session minutes in 6 months. We are doing this because you're required by statute to review any closed session minutes every 6 months. And typically closed session minutes can be, you know, you can open them and destroy the recording. And this is just a special situation where we continue to recommend that they stay closed for now. And we'll see them again in 6 months. But anyway, you all let me know if you want to have a closed session discussion or if you want to just take the vote. People should have received those with the board packet.
All right. I guess I can move to motion to keep the closed session minutes closed. Do I hear a second?
I will second that.
All right. Any discussion? Seeing no discussion, we'll go on to roll call.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Alexa McCoy,
Stephanie, Alexa can't vote on these.
Oh, she wasn't there, yeah.
Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Palencia,
Yes.
Jane Sprandel,
Yes.
Thank you. Well, that's it.
All right. Oh, go ahead.
I'll have the physical board packet for next week's meeting because Stephanie Howard Gallo got on it and sent them out before I even knew it. So thank you. And I just emailed the same to you and the DD board.
Okay.
You're on mute.
I'm sorry. Thank you.
You're about to say the most important thing.
I was going to say thank you, everybody. I know it was a long session, but everyone did a great job. Appreciate everybody's input. I guess I'll see you guys next week. We're going to move to adjourn, right? Do we need a motion? Yeah. All right.
Nope. I second it. You guys have a good one. Take care. Have a good night.
Have a good night, everyone.
Bye.
Bye. Bye.